أنا تجيب.
بسم الله الرحمن الرحيم. السلام عليكم طلابنا، إن شاء الله تكونون بخير. We start with a new subject is acute abdominal pain. Acute abdominal pain. Definition: onset of the pain is usually sudden, within a few hours, less than 24 hours, usually associated with signs of peritonism, guarding, rebound, rigidity. Acute abdominal pain mean pain sudden onset within a few hours associated with sign of peritonism. What are the causes for the abdominal pain? There are gynecological causes, common and less common causes. Common causes: ectopic pregnancy, miscarriage, ovarian cyst, pelvic inflammatory disease. Less common: ovarian adnexal torsion and a tubo-ovarian abscess. History: asking about last menstrual period. As we say, the common gynecological causes for acute abdominal pain is ectopic pregnancy. So the last menstrual period is important to know this female is pregnant and this pregnancy is ended with miscarriage or with ectopic pregnancy. Site of pain and nature: colic or persistence, vaginal discharge, fever, previous past gynecological history. Then important point, asking about last menstrual period, pain and nature, colic or persistent, vaginal discharge, fever, previous past history. Examination: abdomen is soft or rigid, rebound, peritonism when cuff, requiring regular analgesia or not, palpable mass or not. Investigation: pregnancy test is important to exclude miscarriage, ectopic pregnancy, midstream urine to exclude urinary tract infection for microscopy and culture, high vaginal swab, endocervical swab to exclude infection, pelvic infection, fasting blood sugar. Maybe the patient is diabetic ketoacidosis and presenting with acute abdominal pain, which is non-gynecological causes. Serum beta HCG of more than 150, this is mean ectopic pregnancy. Pelvic ultrasound. Diagnosis and treatment: we're talking about the common causes. Ectopic pregnancy, as we know, diagnosis by doing serum beta HCG more than 150, by ultrasound empty uterus with a small amount of vaginal bleeding and adnexal pain. Transvaginal ultrasound is important to diagnose ectopic pregnancy in 80%, while laparoscopy is almost 100%. Treatment, as we know, surgical treatment or non-surgical medical treatment in special situations. Surgical treatment, salpingectomy or salpingotomy, by laparotomy or laparoscopy. Miscarriage, as we know, colicky, pelvic pain, vaginal bleeding moderate or large amount, positive pregnancy test and ultrasound suggest miscarriage. A treatment: either conservative measurement, and this is provided when the patient is hemodynamically stable, or evacuate retained piece of conceptus. Ovarian cyst. Diagnosis: constant pain and cyst at ultrasound. Maybe simple cyst, maybe hemorrhagic cyst, maybe endometrium and dermoid. Treatment: ovarian cyst when less than 5 cm and not requiring regular analgesia, it will be managed conservative. Simple cyst less than 5 cm, not need analgesia, this is mean can be managed conservative. But if the patient require parenteral analgesia, there is sign of acute abdomen, and laparoscopy will be indicated to do ovarian cystectomy. Hemorrhagic ovarian cyst. Hemorrhage into a cyst is usually managed conservative, provided if there is also no pain and hemodynamically stable patient. But if the pain is not controlled and there are signs of peritonism or hemodynamic disturbance, laparoscopic lavage is performed and a cystectomy is employed. Pelvic inflammatory disease. To diagnose pelvic inflammatory disease, there is pyrexia, cervical excitation, dyspareunia, vaginal discharge. White BC will be increased, C-reactive protein increase. This is indicate infection. Laparoscopic is the gold standard for diagnosis, but not required because the PID can. The first line of management is medically with antibiotics. We need laparoscopy because of the tubo-ovarian abscess will be due pelvic infection. Oral treatment, fluoxacillin and metronidazole for 14 days, or intravenous treatment, ceftriaxone and oral antibiotic. If no responsive to IV treatment, consider a tubo-ovarian abscess and indicated laparoscopy for drainage. Thank you very much.